Hello, my name is Tammy Grimes, and this is my assessment for Module 3. And this is my daughter, Haley, and she is my subject this evening. She has no family history of allergies, eczema, or melanoma that she is aware of. Personal history includes some exposure to the sun in the summer. She states she uses sunscreen approximately 75% of the time. She also states she burns easily. Her skin is rough to the touch. It is warm, dry. She does have fine bumps to her shoulders. She admits to getting occasional rashes to her thighs from new pants. Skin color is pink. No apparent rashes, scars, or lesions at this time, and there is no bruising present. Skin is warm, dry, rough to the touch. Her skin turgor shows a good recoil, which is indicates proper hydration. She does have a small circular mole to her right shoulder. It is 0.5 centimeters in diameter by 0.1 in height. It is soft and smooth and a pale tan in color. She has numerous flat freckles to her face, neck, shoulders, arms, chest, her back, and her legs. When we move to her nails, they are pink. They do have a good capillary refill of less than 1 second. When asked to put her thumbs together, she does show a small diamond shape in between her thumbs, and that is a normal finding, indicates that there is no clubbing. Also, she has no splitting or other deformities noted to her nails. Her hair is brown. It is soft. She has very thick hair, distributed evenly across her head. There are no parasites present. When you move into the lymph nodes, she states she has occasional lymphadenopathy when she gets sick, no swelling to extremities, denies malignancy, immune disorders, and infections, also denies injury to her head and neck. Upon inspection of her head and neck, we find her head, I lost my head. Is 23 1/4 inches, which is also 59 centimeters in diameter. Her head is normal cephalic, round in shape, and there are no nodules or lesions upon inspection of her head. Next, I'm going to have her smile. You can see that her face is symmetrical. Everything moves together like it should. There was no facial drooping. Next, we're going to check her range of motion to her neck. Going to have you flex your head forward and tip your head backward. Turn your head from side to side, and then turn your chin to each shoulder. Was there any pain with any of that? No. So her range of motion appears to be normal. Look up for me a little bit. You can see that her trachea here is midline, and it does move when you're gently palpated from side to side. Her thyroid feels smooth, no enlargement noted at all. Her carotids are palpable on each side. And upon auscultation, there is no bruit present. And also there was no thrill felt. Next, we're going to move on to the lymph nodes. The occipital lymph nodes are found at the base of the skull. I'm just going to check with the pads of your fingers, gently pressing, kind of rotating to see if you feel anything there. The post-auricular nodes are located superficially behind the mastoid process, which is right behind the ear. Then we're going to move to the pre-auricular nodes, which are just in front of the ear. Moving down, we're going to go to the tonsillar nodes that are located at the angle of the mandible. Then the submaxillary nodes are halfway between the angle and the tip of the mandible. And then you have these submental nodes, which are just behind the tip of the mandible. Moving down the neck, we find the superior cervical nodes, and they are at the sternocleidomastoid. The posterior cervical nodes are along the anterior border of the trapezius muscle. And then you move down into the deep cervical nodes, which are deep to the sternocleidomastoid and may be difficult to feel if you press too hard. So you have to touch very gently around that. The last one is the supraclavicular nodes, and they are palpated along the angle of the clavicle. So we're going to have have Haley relax her arms so that the muscles are relaxed, and then gently flex your head forward. That relaxes all the soft tissues around the neck. And then they're going to be just along the clavicle. The supraclavicular nodes are a common site for metastatic disease. This concludes my demonstration for Module 3. Thank you.